Hello viewers and welcome to your favorite health program on the internet. On this day, we'll be discussing kidney stone and it's by your regular host and anchor on this program, Ozion the Expressionist. So what actually is kidney stone? Kidney stone is a problem in the kidney where there are deposits of calcium salts, oxalate or calcium sulfate. There are different kinds of salt in the body and some materials and substances in the body and proteins will form salts, a kind of crystals, not the actual stone you see outside. But this is a stone inside the body, just like we discussed about stone in the gallbladder. So these stones are derived from those materials that they come to coagulate, to congeal and sediment in your kidney. The kidney inside your nephron, which of course the kidney is the center of filtration of fluid in your body. That's the waste management center in your body, whereby your blood and other fluids are filtered. So in the course of that filtration, all those materials that are supposed to be passed, some of them are retained in the body while some are taken outside through urine or as urine rather. So when the process is going on, some of them that are supposed to go or either come back will not move accordingly. Now have to sediment and stay at a certain place. It does not cause you pain or any symptom at that time. Yes, it becomes asymptomatic. But at the time these have congealed enough to, and during flushing or during urination, it could not go out for smooth passage and begin to block the ureter. The ureter is the pipe that passes from your kidney to your bladder. So when this causes obstruction, you begin to feel the pain, just like the kind of pain you feel in gallbladder. It's only when movement comes that it begins to tell you. And this particular one is called urolithiasis, or it is called nephrolithiasis. Yes, this is another name for kidney stone. The pain this causes is called renal colic. Is actually a very severe pain that has been compared to as very similar or worse than birth, delivery of a child. Yeah, female birth of a child. That's actually one thing that it has been compared to us. However, when someone is suffering from this, the symptoms include nausea, vomiting, hematuria is blood in your urine, like I said, and as well as you're having infection, yeah, in your blood, high level of infection known as sepsis. It could equally cause you reduce or decrease urine output. So all these, and my colleague resort to fever. With all these symptoms that manifest individually and sometimes differently, the person feels this pain and goes to test and it's found out that you have kidney stone in your body. The next step will be how is it going to be removed? But the question and the other things I will have to reveal to you is here is how do you get it? These are called gotten from if you have the family history of kidney stone, then it's a risk factor that you might have this kidney stone someday. If you are diabetic, watch yourself. It's a risk factor. If you're doing too much stressful activities, that's another thing because there is a kind of hormonal imbalance this creates that might cause you some kind of the it has to do with your cortisol and the rest of the other actions you have in your body to developing a level of dysfunction that will produce this in your body. Another thing are medications. Some medications can cause you this. Even specifically chemotherapy can cause you, it puts you at risk of having kidney stone. So another thing major is obesity. Yeah, people with who are obese often have this kind of condition too, and as well as people who do weight surgery. Yeah, who want to do weight reduction surgery. If you do reduction surgery, it often puts you at risk of having kidney stone. The explanation of all this may not be very pertinent at this stage, but in another video, but let's go straight to when you are suffering from this kidney stone. What do you do and what other things could make it happen? The salts are different. So every kidney stone is not the same, but there is one that is categorized as the number one cause of this. There is the calcium oxalate salt when it is high in your body. There is the there is the calcium phosphate. There is the uric acid. There is the struvite. There is the cystine. So discussing about calcium oxalate, where do we get it? Which means that when calcium is high in your blood, which is known as hypercalcemia, if you remember when we discussed about calcium, that is actually what brings you to this calcium oxalate type of kidney stone. So how does it happen? Calcium oxalate condition is, as much as it is when they increase the calcium in your blood, does not actually mean that you have taken a lot of calcium. Remember, calcium is only getting into our body through the assistance of vitamin D3. And in explaining our vitamin D3, we have explained that those with a black skin absorb about only 15% from the sun unless they take supplement vitamin D3. And those with other kind of skin, or rather the white, have up to 40% of absorption of calcium of vitamin D3. And this vitamin D3 helps in absorption of calcium in the intestine, which hydrolyzes and goes to the kidney to have efficient absorption of calcium. Now, in the cause of this absorption of calcium in the intestine, there is this complex interplay with calcium and oxalates, which often comes during the food that we eat. Most food we eat that have calcium will have oxalates. And this interplay presents the situation that the oxalate inhibits the absorption of calcium and as well as limits the elimination of calcium from the urine. So what goes out most times when this is happening is your oxalate. Oxalate comes in absorption and goes out. The calcium that is already absorbed will now have to be there in your blood. And that's what causes the hypercalcemia. It does not mean that you have taken a lot of calcium or that your vitamin D3 is absorbing so much. No. So that's actually what confuses many health professionals or medical professionals who address this issue. And they will begin to give you medication, tell you to stop taking calcium, and you will be suffering some other diseases or conditions of low calcium in your blood because you are not absorbing this. That's after treating your kidney stone. However, focusing on this, we'll address the other one someday. The calcium, the calcium oxalate is one. We have the uric acid, which comes from purine. Purine comes from certain food like organ meat. Organ meat are the kidney, liver that we eat from food that have this, animals that have this. Another thing that gives us purine and converts to uric acid is alcohol. Yeah, especially beer, wine, and the rest of them. So when these are being taken, it means that you are equally preparing yourself for this kind of condition someday. And it's don't just judge yourself because this person did it and it doesn't. Our bodies are this different. Because of what? Because of our the risk factors I've mentioned, and as well as our hormonal differences in terms of environmental and other things. So don't just compare, but try to ensure that you manage your body in a way you wouldn't be exposed to this kind of conditions. So what do you do to this person who is suffering from this and there's always an intense pain? There are certain things that need to be done. Locally, you would have to use something like lemon. Yeah, lemon drinking in water. But then basically you need a lot of fluid intake, like 3 liters every day. Yes, 3 liters, nothing more. Just ensure that you reach up to from 2.5 between 2.5 to 3 liters every day. Maintain that so that you'll be able to flush this stone. This stone does not really pass from the kidney out just because it is there. Because when it is at the early stage, it is just sedimented and remains there. Because during the filtration, like I said, the kidney is the center for fluid waste management of the body. It flushes the blood and other fluid. So when these are sedimented, their movement will be difficult because they are just there until they congeal. When they congeal very well and wouldn't move, in the ureter, they begin to block the ureter, and that is when you feel the pain. So it needs something to get it out. And trying to get it out depends on the size. And if it is too big, it might cause you injury that will result to another problem in your kidney, which might equally lead you to kidney failure someday. So to prevent all these episodes of disease condition to come up, you will need to begin as early as possible from today to drink enough water to prevent yourself from being exposed to kidney stone, which can come through different ways. Just talk about purine. We just talk about calcium oxalate. There is equally calcium phosphate. There is struvite. There is cysteine. To ensure that these don't, all of them can be prevented by enough drinking of water. When it is already there and the pain is there, you will need something that will have to decrease the inflammation it might cause you, something like lemon in your water. But don't make it too toxic because lemon can make it too acidic and you'll begin to suffer differently. Lemon in your water, even cranberry has been said to be very helpful, or vinegar. Those you could try. But then at the end of the day, if anything doesn't happen between 2 months to 3 months. Then you will need to see your doctor for surgery, or what you call or what we call the breaking down of it, so without even surgery. But so most times it ends in surgery, whereby you will need what you ureteroscopy. Yeah, that's using a camera that goes in there and then get it out. As well as the thing, other types of surgeries that could be used. There are different types of surgery, which I may not have to mention now. But the thing is that you will need enough water in the process of waiting for this, and the doctor might present to you options of how you will have to use, which one you will have to choose. Is it this kind of surgery? Is it the shrinkage lithotropy? Is it the ureteroscopy? Is it the percutaneous nephro? There are so many of them. So at this point, I would have to end this video and let you know that we will continue to bring you information on this. In your comment section, please ask questions, any question on this issue, so that we'll have to address it. Because a lot of people are suffering from this disease and we wouldn't like you to continue. And we can provide a solution to some extent, reasonably enough. Thank you so much once again, and continue to watch Ozion the Expressionist on this program. The Howard Center with Ozion Art Studio. Bye.